But we are, okay, recording, cool. We are an AI company. And just to give everyone a little idea of what AI is, I have some slides for that. So our main mission is to use AI to maximize both health and safety of caregivers and seniors. We see a lot of focus on seniors, but for us, we are building a tool for caregivers. And for us, we think that the happier and healthier a caregiver is, the better care they can provide. Our product is a small wall-mounted device that's completely non-wearable, and it automatically detects things from falling, sitting up, standing up, any emergencies or basically activities of daily that you might be interested within a room. And we send automated alerts and everything. And we'll get more into it after kind of discussing what AI is. So what is AI? Artificial intelligence is basically a way for computers to understand what's going on in the real world and take a bunch of data to be able to perform human-like tasks. So for example, Teslas, everyone knows what Teslas are. The way they self-drive is through AI. Even things like Siri, like your personal smart assistant on your phone, that's all AI based. There's not someone on the other line listening to your request. It's all automated. And this cancer screening, completely automated. This whole industry is changing because a lot of times humans can't see little things and always catch things because of human error, but a machine always can. So AI has a lot of potential in helping humanity, really. A subset of artificial intelligence, computer vision. So this is training computers using AI to interpret and understand what the visual world is doing. So on the side here, you'll see it's tracking. It's a person, dog, couch. It's pretty simple for humans to do, but for a computer who has no idea kind of what any of this means, it's very difficult. So it takes a lot of data. So these machines can accurately locate, identify, predict, detect anything using a variety of sensors. And then they react to kind of what they've seen and spit out whatever inputs that is required, whether it's an alert or something like that. So problems. There's a huge problem in our industry, the growing need for elder care. 10,000 baby boomers turning 65 per day, and about half of them will need long-term care services. And almost every single older adult wants to age in place. And we really want to make that more affordable. On top of that, there's a massive caregiver shortage. As the population of seniors increases, the caregiver population decreases. And even in the next 10 years, we'll be in the complete negative of the type of caregivers that we need. Caregiving is costly and exhausting. This is one of the main reasons that pushed us to create something like this using AI. And one of the benefits of AI is that it makes it so affordable because it takes away the requirement for humans to have to spend their one-on-one time, which is very valuable and expensive. And our big thing is for us to be a tool for caregivers. 30% of family caregivers report depression. It's honestly probably higher than that. We work with researchers at UCSD that completely focus on stress just in caregivers. And there's a lot of statistics that show that when caregivers are done giving care at the end of their loved one's life, their health is worse than when their loved one's health was when they first started getting that care. And that's really difficult. And it's because there is no support system for caregivers. Right now, an alternative would be to get a professional in-home caregiver just for 12 hours a night. And that's about $5,000, $6,000 per month. And that's just to have 12 hours a night to maybe have like respite and get some sleep at night. So it's really unaffordable and it's very difficult. And also current caregiver shortages, even if you can afford for caregivers, you can't find them. And even if you can't have them for a long time, maybe 4 hours a day for a few times a week. So it gets very difficult. And to families, they're having to spend so much money, dip into their personal savings. And a big thing is have to cut on vacation. And that's something that, we've received testimonials on. They've texted us while they're on the beach saying like, hey, I'm on vacation because of your device. So just hearing things like that is amazing. And all this is done through AI. AI has been applied to so many other industries, and we're sending people like to Mars and to the moon, but we can't figure out how to better care for our seniors and our caregivers. But that's kind of why we are here, and we're passionate about bringing this modern technology to this almost antiquated world in terms of the type of other alternative resources there are. So an AI solution like us, we're $55 per month compared to $5,000, $6,000. And anything using AI will be significantly cheaper. Somewhere around us, we have competitors that are more expensive, but compared to 5, 6K a month, it's a huge difference. And this is to have 24/7 care monitoring within your home instead of just 40 hours a week. And that's the big thing about AI. It never gets tired. It's always on, always monitoring, doesn't get fatigued. So these are the existing solutions I'm sure we're all aware of. What we most commonly see are things like bed pressure sensors, bed motion sensors, and these have extremely high false alarm rates. And especially in a community where caregivers have to, the way they're alerted is all based on sound. So they have all these alarms blaring and beeping around the community, and the seniors hear all this too. It's chaos. And the type of you get so many high false alarms, just flipping over, turning the pillow, a blanket falls to the side and it triggers an alarm. So it's very difficult. Wearable buttons, push cords, they all require someone to actually be mobile and able to press these buttons. And a lot of times when we think of an emergency, that's not possible. And at home environments, we've seen a lot of our caregivers use things like baby monitors and security cameras, and they're just listening in to see, like, do I hear the walker moving around? Will I maybe be able to check in the app and see that they're still sleeping, anything like that? But the problem is that there's no smart detection, mobile alerts, or any type of analytics. And that's why we're combining care with AI. Combining care with AI means happier caregivers and safer seniors. So for caregivers, we're increasing their awareness. We're multiplying the amount of residents, clients that they can view at the same time. We're also decreasing the amount of time that they're actually having to sit there and watch, because they're getting automatically notified. And on top of that, it provides tremendous peace of mind to families and both professional caregivers. And for seniors, it tremendously increases their safety while increasing their privacy as well. Because instead of having a caregiver always walk into the room checking in, now you just are able to have a caregiver dispatched to you only when something's wrong. And on top of that, AI has been able to produce a lot of data. And this data based on activities of daily living is something that hasn't really existed before, especially for our doctors. So this actually provides ways to provide proactive care instead of traditional reactive care that we've seen. These are our partners so far. We work in memory care, assisted living, in-home care services. We work really heavily with UCSD and their health system, and work on a lot of research with them as well. So how it works? Yeah, so we're a simple sensor device that you slap on the wall. You don't have to wear anything. We apply our AI software to it, and it produces mobile alerts and data analytics. So these are an example of the type of alerts that you could get. So for example, action detection. You can detect when someone's specifically standing, sitting up, fallen, or anything like that. But a really particular thing that has come out because the fact that we're so accurate is that we can detect and predict when someone is sitting up in bed, which enables us to actually dispatch caregivers to help prevent falls. You see a lot of fall prevention methods where, it's like training, and those work really well. But especially in memory care units, when, caregivers have no idea what's going on and the residents, have a hard time vocalizing what they need, you really need to be able to have a real tangible way to prevent falls, which is to dispatch before they actually even stand up and are at risk. Emergency detections, anything from falls to also being away from bed for too long. So this is a particular one that our caregivers love, is for when they know that the resident or client is able to toilet themselves, but they mainly want to know, are they okay? And have they actually returned to bed or their neutral point of safety from the bathroom? So we'll always be able to alert on that, even if they fell in the bathroom or anywhere else, they'll always be alerted, and there's a backup if the fall is not detected itself. And daily updates. So this is a really easy way for families and caregivers to tell how their resident loved one was doing the previous night before. Emergencies don't happen all the time, so we want to provide data to show that things are still being monitored. You can see how long they're sleeping, when they're awake, things like that. So in a community, we're essentially changing the way care is given. Instead of having these rounds check-in systems where every 2+ hours you're going around the community, seeing and checking in if residents are okay, now it's a dispatch system where caregivers are directly dispatched to residents in vulnerable positions. So, for example, we have this monitor in our communities where they'll have this on a big screen, big TV screen, or a big computer screen in a central area, and they'll be able to monitor this. And anytime there's an emergency or a fall, the tile will turn red for that specific room, and they'll get a phone call or an alert that'll tell them, hey, you need to go check on this room. Just last week, we detected a fall. We were able to alert the med tech within minutes and potentially save that woman's life. And so it's very different from how it used to be. Someone could fall and you wouldn't find them for 2-3 hours because maybe you had just checked in on them and you don't plan on checking on them a couple hours later. But now it doesn't matter what time of the day or night, as soon as something happens, caregivers will know. And this makes it much easier for one caregiver to be able to manage a whole floor or a building of residents, even if another caregiver calls out sick or these days the caregiver turnover rate is so high. So the existing caregivers need a better way to be able to handle the population. So one of the biggest things that we work with, the geriatricians and our doctors, are these data-driven health insights. So we not only do we detect and alert, but we produce a lot of data in terms of activities of daily living. So for example, we could even start to predict and notify caregivers on UTI progressions, on things like how long are they in the bathroom for, how often are they using the bathroom, how frequently are they going during the nighttime, and seeing that trend over time can give a really good glimpse of what's going on in terms of pattern changing, irregular sleep, fall risks. And of course, it's data-based proactive care plan adjustments, which you actually need data for. So these are the type of data that we collect. So safety score. This is a really easy way for a caregiver to see how their residents' wellness was the previous night before, in terms of whether they were sitting for a long period of time, standing, depends on how much of a fall prone state you've been in. So what our families have been able to do is, as this safety score drops, they're able to actually bring in daytime caregivers for families. And this is for the in-home care setting. And because they'll know that, hey, didn't get a lot of good sleep last night, he's going to be pretty tired and exhausted today. So we'll bring in a caregiver to make sure he's okay. Things like that. Time in bed last night, how long they've slept, pretty simple. But there wasn't really a easy way to kind of detect and get this solid, clean, accurate information until now. How many times left the bed. And this graph here was a really easy way to see their activity during the nighttime. And something interesting that we found before is we had a resident who was sitting at her side of their bed. This is in a memory care unit, and she was sitting at the side of their bed for 2 to 3 hours a night, waiting to go to the bathroom. But caregivers would never know, because as soon as they would get there, they would expect, oh, she just sat up, she's ready to go to the bathroom. And the only reason we knew is because her safety score is decreasing, and we could see in the graph that she was sitting for extended periods of time. So now when she sits up, the caregivers are able to help her immediately, and she's not sitting up and getting poor sleep every single night because of that. That's a kind of an example. And at the bottom here, we help caregivers, especially as shifts change, understand their residents better, especially when a new resident moves in. They're able to understand, hey, what time of the night are they most frequently active, and what part of the population should I focus on during this time of the hour. So that's really helpful for caregivers to understand nightly patterns. And this historical data over time is a really big one. As soon as anything changes, if a resident is sleeping 8 to 9 hours a day, and then suddenly they're sleeping only 3 hours, you can tell that something's probably wrong, and it's a good time to kind of check in. And on top of that, we do a lot of other data analytics where we can, put in things like how well they've slept, their mood behavior, their appetite, activities, if they've taken their medication. And we've been working with Mejia Senior Living to figure out if their mood significantly decreases and their appetite, it's a pretty good idea to check for a UTI. And so far, it's been pretty accurate in terms of how they've been able to kind of predict these things by just seeing changes in inputs. Yeah, so to kind of summarize all that, for the care communities, our main benefits and the things that all AI could honestly provide are increased safety and the reduced risk of injuries. Caregivers are more efficient and their care is more effective in terms of the choices they make based on data, and also increases sales and resident retention. I mean, we've seen that a lot of communities are all exactly the same in terms of kind of what they offer. So the communities that our products are in, AI protection, in terms of the added layer of safety, we've been able to bring in more residents to these communities. So we know families really value this type of technology. And at home, so specifically, we have something called the shared care model. And this is essentially an ability for a single caregiver to monitor multiple clients in a single region. This allows for these underprivileged families, these low income, informal family caregivers to actually afford a new type of plan that doesn't, directly include hiring a full-time caregiver to come to your place and having to spend that kind of money. So this is a great way for families to still get the care and monitoring they need without having to empty their savings accounts. And on top of that, a huge benefit for care companies as well. Now they're able to serve all the clients that they have asking them for help without having to find extra caregivers, because now it's not a 1-to-1 ratio between caregiver and client. It's 1-to-5, 1-to-8. And a caregiver will basically be able to go around the neighborhood and check in on emergencies based on the alerts that she gets on her phone. Yeah, these are some of the testimonials. So on the left here is the example that I said that they've been able to go to the beach because they have our device. We're a really great way to provide respite, and AI, just AI in general, because it removes the need for a human to be there and to be, aware of what's going on. It saves a lot of time, which essentially saves a lot of costs. So I really think in like the next 5-10 years, we'll see a lot of AI technologies coming into this field, and I think it'll be changing this caregiving world for the better. And yeah, so the startup journey, I kind of explained how we worked with Microsoft, and then we went to UC San Diego. My co-founder went to University of Virginia, because we are from Virginia. And once we got to San Diego here, just to talk about kind of how the startup came to be, and for those interested of starting your own thing, universities in general have so many resources to help with entrepreneurship, and especially UCSD. UCSD Health, they just raised billions of dollars literally to fund entrepreneurship there. They have 2 brand new buildings that people can come and prototype things, build things, meet people in the industry. A specific building that we work out of is called a Design and Innovation Building. And we came out of this accelerator called the Basement. And a lot of these resources are not just specifically limited to UCSD students or alumni or people who are affiliated. It's for people who have an interest. And so I would highly recommend to just check out UCSD entrepreneurship and see even the classes that they offer at Radies, because I know for us, we've learned a lot, but being connected to people there that know what needs to get done and kind of the people we need to talk to has really pushed us to kind of get this far, at least as far as we've gotten. And on top of that, YPSS has been huge. Our first 3 largest partnerships came from YPSS. I've been going to these meetings for a year, maybe a year and a half now. And every single meeting has been so productive. So it's been amazing. And definitely, if you're new to YPSS and you're trying to make great connections, this has been a great place. So I definitely highly recommend that. And if anyone ever has any questions about our journey on kind of how we've gotten to this point and getting connected to UCSD, if maybe you have an idea, because there's a lot of different things that can be innovated in the care world, especially, please let me know, and I'd definitely be happy to help. But I think this is the last slide. Yeah, thank you.
we'd love to, thank you, G. That was great. We'd love to open it up to questions. I know when I went through this presentation, I was like so fascinated and I was like, what about this? What about this? So if anybody has questions, please raise your hand or just unmute yourself and feel free to ask. Ellen.
Hi, yes. This is fascinating to me. It's so exciting to hear about AI and all the ways in which it can be used. And Kim and I were just chatting and wondering, have you piloted this at all at any community yet? Have you piloted with any partners so far?
Yes, so we actually have live devices in Cadence, Pacifica, Stellar Care.
Okay.
We're just starting with accident care through UCSD. But yeah, we're fully servicing families, private families in the region, our memory care units, assisted living. We're fully functioning, fully reliable. So yeah, good to go. Thank you.
Awesome. Any other questions? Katie.
Thank you so much for going through all of that. My question is in regards to like the at-home service. Are you primarily just putting these in bedrooms or do you need one in other rooms? And have you gotten any pushback with regards to privacy there?
Yeah, so our private homes, we honestly thought that privacy was a big issue, but we mainly get our privacy and liability, and we deal with all that with our communities when we're HIPAA compliant and everything. So, but in terms of at home, we hear all the time seniors are like, I have nothing to hide anymore. And generally the families are like, I just want to make sure that they're safe and I know how I can help them age at home safer. So really no pushback on that. But in private homes, we just have to put one device in the bedroom. We're perfect for that 12-hour nighttime shift. We're working to expand to during the daytime, and we will be able to very soon. But perfect for that 12-hour night, and we only need it in one, just the bedroom and no other places because of the way that the system's designed.
Okay, so potential for other rooms down the road if the tech can handle daytime activity, is that the
Right,
goal?
we can, we just have to, we've seen a lot more need for the nighttime, especially because, I mean, we provide private families the ability to get good sleep at night. And that's the one thing that they're kind of looking for, so.
Yeah.
Thank you.
Awesome, Diego.
Yeah, great presentation. Loved learning more about your product here. Quick question about medication management. I know that medication management is a huge cause of hospitalization and a huge gap for in-home caregiving to fill. Do you folks plan to add anything as it relates to med management in the home, or reminders or something to that effect?
Yeah, so our big goal is to be a platform. You know, we have a place where caregivers can implement their own type of data and medication management. So we will have those type of features so it's like a one-stop shop for, you know, any caregivers to go to make sure everything's done. But on top of that, since our type of AI field is human action recognition, and we're so accurate in that, in the future, I could totally see us being able to detect when people take medication or even implemented a new, you know, IoT device that could show that people have taken medication. So yeah, we've definitely considered that in terms of the ecosystem that we want to create. Thank you.
Great. If anyone else have a question? I do have one if no one else has. Oh, Todd, go ahead, Todd.
Oh,
you're on mute.
Thank you. All right. Are you able to control for things like if a dog comes into the room and there's movement going on, but it's not the person in question, or even a caregiver comes into the room? Are you able to discern who the client is and that anything else is just extraneous movement?
Yes, yes, we can. We deal with cats, big cats, crazy cats, giant dogs. I mean, in communities, caregivers walk in all the time, so we manage that all.
Cool.
Thank you.
Awesome. My question was about, and something you mentioned to me, but in terms of like future investment and hoping to expand. What does that kind of look like for you guys?
Yeah, so at the point that we are now, we're just trying to get as many partnerships as we can and, find the ways to grow and get this technology to the people who need it. We're really trying to target like those informal family caregivers. So we work a lot with in-home care services. But at the same time, we know we have such a big impact on memory care units and assisted living. So we're pushing through that. But in the next few months, we plan on raising our seed round, and we've bootstrapped this all the way, my co-founder and I, just for the fact that, if we raise, we don't want to raise so much and we lose half the company. And because we've seen competitors do the same thing and they've completely pivoted away from, building something that's really important that we see that we'll need in our futures as well. So it's really important for us to kind of be able to have the strength and backing with our big partnerships and our good growth so that we can tell investors, hey, we know what we're doing. We've done all this so far. So just trust us. So that's the kind of stage that we're at, and we're getting super close. So super exciting.
Very cool. I did get a request if you could stop sharing your screen so everyone can see.
Gotcha.
There we go. Mary Ann.
Gee, thank you again for a wonderful presentation.
Thank you.
I don't have a question. I just wanted to make a comment that you mentioned. Just the fact that you can identify someone who fell and that they can get help right away is worth so much more than anything else. You hear so many stories about people who couldn't get to the phone, didn't have the strength to call out for help, or nobody could hear them. Right. And ended up on the floor or worse. Getting them out of that pain and having attention. Thank you so very much. It's amazing.
Yeah, I mean, that's one of our biggest things. And Brandon, I mean, I'm sure he has a story to share on that as well.
Oh no, yeah. I just we've witnessed it ourselves with our own loved ones and the people that we care for with our devices, and the fact that we can help minimize that suffering that people go through. Like people just don't really talk about it that much, but it is a really big problem in society, and it's scary for us to talk about. And we want to minimize that. The fact, our solution, like we only need one device in the home, particularly at night, because we're measuring both if we detect a fall, but also if you didn't get back in bed. So we're able to detect it when you're in the room and alerts, but also when you're outside of the room. And so the maximum time we want anyone to ever be in that position, even if we're not monitored, like we can't see that person in the room, is 20 or 30 minutes max, as opposed to hours and hours, which like we're aware of those things happening very regularly, not just at home, but in facilities, unfortunately, as well. And so when we have stories like last week at Cadence, we were able to, dispatch a caregiver with our device, and they were only on the ground for like 5 minutes. That's huge, because otherwise it would have been a few hours.
Or more. Thank you.
Yeah, and we want to build up data, like just through this as we scale, and really have not just stories to tell, but real strong metrics. Like this is the amount of time we've estimated that we've saved elders from on being on the ground in those positions, and falls that we've saved, like G said, from sitting up at the side of the bed. Yeah, it's really, really impactful.
Yeah, I think everyone's gone through those stories. Even my grandpa, he was in assisted living years ago, and he had a call device around his neck, and he fell on his bed sideways, twisted his ankle, and he was there for, we have no idea how long before they found him, and he was somewhat out of it. So yeah, I mean, just this device, the potential is pretty amazing.
Right. And compared to our competitors too, like what we're doing really specifically, initially we want to scale in facilities because we need to collect that data set to make ourselves really accurate. One thing that's unique about us, people talked about dogs and cats, we have the ability with our AI to adapt and really learn in a lot of different environments and be accurate. Other people, our competitors, don't really have that opportunity. And but we do have people doing kind of similar things in the facility space. Initially, we want to scale out. And what makes us really unique is the affordability and the fact that we work in the home. And so the second thing is, as we start to, have the ability, right now, we can't just ship off the device to some random place. We have to make sure that we're ensuring the accuracy. As we scale in facilities, then we want to enter more prominently in the retail space. And that's where we think we're going to have a lot more impact, and where our real opportunity is, because that's actually like a lot bigger than assisted living and all of the community and facility space. There's way more people who want to age in place.
Way more informal family caregivers. Yeah.
Right.
Especially everyone wants to age at home.
Right.
Yeah.
Preston, I believe you had a question.
Yes, but I think Lena has her hand up, unless if she has a question before me or no.
Oh no, Preston, you can go ahead. No worries.
Okay. Yeah. So so first off, guys, awesome product. I like it a lot. I work with PACE, so we don't necessarily have a residential facility. We contract with other places, and we bring participants in centers and stuff like that. But my question was, have you guys thought about expanding to maybe more like measuring blood pressure when they're in the home, or more type medical type situations that can then feed into their doctor's office, and then queue up things. Have you guys thought about that as well?
So we've considered doing kind of more like medical related things, but there's so many other companies out there doing it much better, and they're a lot more. I mean, it's a harder thing to do for sure, and it does require wearables. And our big thing is we don't want to wear or have wearables. But our big thing is we don't really focus on like heart rate, blood pressure, because we focus on activities of daily living. And the geriatricians that we work with, they care more for these ADLs in terms of making they're signing off on certain medications and prescriptions, things like that. So for us, we haven't seen that much of a need for it until we maybe enter like a more hospital setting or things like that. But yeah, we thought about it, and it's a great idea.
Yeah, and it's a new space, right? Like, we're trying to connect data from all sorts of different places, ADLs, heart rate, blood pressure, all these things. No, like the data we're generating doesn't exist currently. And so, part of why we love having these geriatricians experts on board is so we can understand the value of connecting the data sets and how we should be doing that. And maybe at some point in the future, we can come up with some cool insights and kind of alert people, not just when there's falls, but also when there's changes in these other kind of abstract data, like,
Right.
You got up to way more times this month than last month, like something's wrong, or, your blood pressure plus the number of times you've gotten up is, like there's all these kind of combinations of analysis that I think probably in the next 10 years, people are going to put together in meaningful ways.
Okay, thank you.
I think Lena, you were next, and then we'll go to Becky.
Yeah, awesome. Amazing presentation. I loved hearing about, how you got started. My story is similar to yours. My great aunt was diagnosed with Alzheimer's when I was little. So seeing my parents take care of her, I know was a big strain on them. Question about kind of piggybacking off of what Kelly said about expanding. Any plans on maybe translating the portal or anything into different languages to reach more of our more high-risk families? Because I think about our families that we serve in Spanish or Tagalog or in Chinese. So any plans there?
Yeah. So we actually been. You might know a lady named Von Couples, and that was actually an idea that she had mentioned a while ago. And yeah, there's so many communities out here that, especially when you start getting dementia, you revert back to your primary language. So it's super hard, and that language barrier. So yeah, that's definitely something that we can do, and I'm really glad that you brought that up again. Thank you.
Yeah, of course. Again, just thank you. I think this is, I think Marianne said, invaluable for families. So wonderful to see
Really
that all the
appreciate
work you're
that.
doing.
It
Yeah.
keeps us going and motivated. Thank you.
Yeah. Mhm.
Great question, Lena. All right, Becky.
My question was, well, my mother-in-law recently fell at home, and she uses her walker. She gets around, and she fell and cracked her hip. So for like 4 or 5 hours, she was on the floor until finally somebody came home, because she does have someone that lives there. Her son comes and goes. So how would your system help her? Like if she was in the kitchen and she fell, and then she
Yeah.
dragged herself, tried to go to the phone, but couldn't reach the phone to call somebody.
Yeah.
Your system help her in that way?
Right now we focus on nighttime care. So if she fell in the kitchen during the day, we wouldn't have detected it because we don't have a device there. If she was somehow, in the bedroom when she fell, we would have sent a phone call to the family and alerting and so forth. Another feature that is kind of useful for daytime that we're currently piloting in a resident's home is call for help. So as part of our device, if someone falls and they yell help or a set of keywords, it'll make that emergency phone call too. So if she's within yelling distance of the device or room, that's something that, yeah, and like two-way audio. So like, yeah.
I see. Okay.
And on top of that, for the daytime, this is something that we've had a lot of requests from other families, and we can do in the future once we kind of start testing it further. Is the way our technology works is basically we treat the bed as a neutral point of safety. And for example, seniors generally, whether they're in their bed or they're in the kitchen, their neutral point of safety during the daytime might be the couch, kind of like the lazy boy chair or something like that. Because they're generally in the same place. So we could apply that same thing to daytime and make sure that, clients are always returning to that neutral point of safety. And if they're in the kitchen for like, an hour and that's long,